So can someone confirm that you can see my presentation, and then I will kick off.
Yes, we can see that.
Excellent, thank you so much. All right, so let's start. So first of all, good morning, Boker Tov, hyvää huomenta. Welcome everybody to our Finnish HealthTech Trade Mission to Tel Aviv info webinar. My name is Sami Jääskeläinen. I'm the Counsellor for Trade and Investment, working with the Finnish embassy here in Tel Aviv. And I'll be your host and MC today. So it's my great pleasure to warmly welcome you all our session today. A couple of household rules as usual before we kick off. So please keep yourself muted. This session will be recorded, and then the video recording and also all the presentations that you're seeing today will be shared with all the participants either later today or then tomorrow. We do have the generic Q&A at the end, and but if you have questions for our hospital representatives, we have allocated a minute or two after each presentation, so you can ask those questions. You can do it by unmuting yourself or put your question in the chat. Either way is fine. And yeah, that should be all. So without any further ado, let's jump into the agenda. We have a lot of ground to cover today. So we are very lucky and happy to have 4 leading hospitals and health institution representatives with us today. So we have Assuta, Arc Innovation at Sheba Medical Center, then Clalit Innovation and Hadasit and Hadassah team joining us. They each will go through basically who they are, what are they doing, what kind of innovations they're looking for, how do they collaborate with the startups and so on. And you will also meet all the delegation participants, then will meet meet all these hospitals and their teams in the autumn, plus more. And then at the end, we have about half an hour to go through basically the overall delegation agenda. And we also have a time for Q&A. And that's it for today. But now, without any further ado, I'm going to hand over the stage to Daniel Rabina, who is the Director of Innovation and Ventures Development from Assuta Hospital. So with that, Daniel, I'm going to stop sharing and hand over the stage to you.
So hi everyone. I'm a little sick today, so I will try to do my best to do this without coughing, but maybe I will have some pauses for coughing on the middle, so apologies in advance. I will try to share my screen. Let's see. So just let me know if you can see that.
Yes, we can see it. Thank you.
Great. So thank you, Sami, for inviting me here today. As Sami said, I'm Daniel, and I'm Director of Innovation and Venture Development at Assuta Medical Centers. And I will take the few next minutes in order to get you more familiarized with us. So Assuta is a part of the Maccabi group. Maccabi is the second largest HMO in Israel, covering about 2.5 million members. In the group, we have different community type of settings. So we have the healthcare services in the community and the alternative medicine clinics, and elderly care also, and dentist. And we are a part of Assuta, which is the largest chain of hospitals in Israel, the private hospitals in Israel. And in our group, we also have some innovation arms. So we have an early stage VC, which is eHealth Ventures, and a late stage VC, which is Alive. Apologies. We also have another innovation arm, which is the research institution of Maccabi. They're called KSM. Maybe you will get to meet them as well. And RISE, which I'm presenting over here. And RISE is Assuta's R&D collaboration arm, and this is what we're going to discuss here today. So our vision is basically to go and try to revolutionize the way we provide care to our patients through innovation and through collaborations with the industry and with the academia. And this is something that I think is quite unique, because usually when you're discussing with an innovation center in a hospital, so this is some sort of a lab that you work in a clean environment at the side of the hospital. And then at the end, you try and look and see how it really integrates with everything. And we are a part of the organization, and we are really looking to, from the beginning of the project till the end, see how at the end of the day this could really work in actual clinical practice in Assuta and in other places. And we really work closely with the teams. So this means that any project that we have is actually running with the actual members that will, at the end of the day, will be the users or the clients of the project. And we're looking on the deployment from the very early stages of the project. So this is the implementation of this vision. Basically, what RISE is doing is trying to connect the many different assets that we have at Assuta. So we have data, clinical workflows, physicians and teams and medical facilities, and to accelerate their availability and collaborations with different partners from the ecosystem around us. So different types of early stage companies, entrepreneurs, startups, and more mature companies coming from different fields, but all around medical innovation. So it's mainly diagnostic, digital, and AI, also devices, either actual interventional or just, excuse me, I forgot the word, and pharma companies as well. Hopefully next time I'll meet you, I'll be in a better condition. So basically, RISE is your gateway to Assuta. So the numbers, since we got the presentation here, got a little bit higher because Assuta is growing. So everything here should be doubled at about, we should add about 25%. So there's about 1.8 million patients that we meet every year in 8 medical centers throughout Israel, with 2,400 expert physicians. So the way we work is all around choice, and it's a little bit similar to the way private systems are working, mainly in the US. So the patient is choosing a specific physician they would like to get care from, and then the physician is choosing to come and work in Assuta on their private clinic. So there's no wards, there's no departments, and all of our physicians are professional and experts. And this means that you can get different type of schools of medicine on the same type of procedure or diagnostic in our facilities coming from different hospitals. So it's like having a few hospitals in one hospital, because every physician is working on the way that they're used to work. So everything is around choice and very around the patient. So it's all about the patient-centered care. So for example, if an oncology patient in a normal hospital has to come for a session of treatment a number of times through different times of visits during a few weeks. So in Assuta, we will know that, for example, prostate cancer patients are coming on Sundays between 2 and 4. And the whole system is built for those patients, so they will get all the different tests they have to do. They will get the results, they will get a consultant, and they will get the treatment all on the same slot that they have on the same day. So it's also really around operations, and you're going to see that in a while with the numbers that we have. And everything is around providing the best type of service and quality of care to our patients. So everything we do a lot. We don't have like a long tail of different types of procedures and types of diagnostics that we give care to. It's fairly known in advance because everything we do is elective. There is no emergency care and no internal medicine departments. So we can really plan in advance what we do. There are surprises and are things that we don't know in advance, but we can really utilize our facilities to the max. So with relatively small amount of infrastructures and teams, we provide care to a really large number of patients in a really, really high quality because we know and we can plan everything. So we mainly do surgical activities. This is our specialty, and we do about 15% of the surgical procedures in Israel. You can see the numbers over here. It's more than 110,000 every year. And we do a lot of diagnostics, more than 1 million diagnostic exams, mainly imaging, which I guess I will be describing in a few slides. And we also do a lot of pathologist exams and gastro and colonoscopies and ophthalmology. So really a lot, and everything is kept in a centralized center database and systems that are working and standardized centrally. And this is a really good playground for testing and validating your innovations. We also have specific domains where we have an ongoing relation with the patient, and this is mainly around oncology and fertility. We also have those types of relations with patients on dialysis, cardiology, ophthalmology, sleep clinic. But mainly we have a peak event that we are providing care to a patient, and then we don't see the patient for a few months or years, and then we see them again, except for those situations when we provide the whole care. So the numbers on imaging are really huge in any international level. So it's already more than 200,000 CTs every year, and MRIs about 100,000 that we do every year, and the numbers are really big, and we're already deploying AI and different type of testings of AI that we do on those imagings, and this is something that we see as a really good ground for collaboration with industry. So the way we work at RISE is basically trying to see what our collaborator need, and then try to adapt ourselves to the need of our partner. So it really depends on the type of product that you're developing, and also on the phase that you are on the development cycle. And then basically we try and see what you can get from Assuta, and see how Assuta can help your company or your idea to grow and later on be actually utilized both in Assuta and also abroad in Europe and in the US or any type of market that you're looking to aim. And we have different resources that we can use for each phase. So I wouldn't go really deeply here because we don't have a lot of time. But I would mention that we can assist in product design and different types of co-developments of products. We have a really strong clinical trial unit that is conducting already more than 200 sponsored trials every year throughout the network, and we know how to do that. And also data sharing is somewhere here in between, and we have a really strong way of doing that I'll show in a minute. And we can pilot and really deploy your product in actual clinical settings and integrate it into our IT. And also we can help and assist with growth and scaling up and do more business type of networking together, and actually also building the use case together, which is more happening over here usually. So Assuta AI is our facility that is continuously growing together with NVIDIA and Amazon and AWS for actually providing access to external partners to our data for R&D purposes. So it's mainly targeted on heavy types of data. So it could be either medical imaging or different images or videos that we capture from the OR or from the pathology lab or from cardiology, and just provide access to the anonymized data that we know how to make, both on retrospective work and for prospective work and actual inferencing in clinical settings, because we have an amazing facility that we've built with NVIDIA on-premise and also on cloud. And we also have the experience of doing that because we're actually already deploying AI in clinical settings in huge scales. So we see ourselves as a very good partner for doing that together with our clinicians and with our teams. There's more description over here. We do that with a relatively small team, but everyone is really top professional and knows what they do. So somehow this seems to work. We also have a collaboration, as I mentioned, with different type of partners, going from investments to different, and the network has grown since we put that slide on. and we also know how to create the different business network, mainly in the US. So if anyone would like to get in touch before you're arriving to Israel, so here is my email, and you're also very, very welcome to check the website and follow us on LinkedIn. Just look for Rise Scaling Health Tech at Assuta on LinkedIn. And on the last time that we have a delegation with Sami, so we got a really good collaboration out of it with a Finnish company. So hopefully this would happen this time as well. And I'm here for some questions. Thank you.
Excellent. Thank you so much, Daniel. Good. Do we have any questions from the audience at this point? Finns are all quiet. I think that it's too early and more coffee needed. But okay.
No,
but
no
we
doubt
will...
about that.
No, I have a comment, if I
Yes,
may. Hi, Daniel.
absolutely.
Thank you very much for a presentation. I think it just sounds so good altogether, what you do and how you try to connect everything, the important stakeholders all together. So it's obviously very valuable for the startups in the early phase as well as later on. So this is a really a very nice example as to how things should be done and can be done. So really eager to discuss with you about Monside. It's a diagnostic tool for personalizing high cholesterol treatment to see if there's a possibilities to work together. So there's really a lot of possibilities. And so I won't go into many questions here, but maybe I'll take it down directly with you. Thank you.
Great. Thank you.
Thanks, Daniel. One question from me, Pekka here. What happens in practice if one of us reaches out to you with a proposal? What is your process like? How do you identify if it's something that interests you, and what happens next?
So that's a great question, the million-dollar question. So basically, we sit together with you, and first of all, we understand what are you interested in, whether it's validating your product or having some initial deployment, or just to do some ideation together with us, or go for purchasing. At the end of this process, we understand what are your goals, what the product can do, and what we can provide you, and try to think about it together with you. If we see a good fit and alignment, then we sit together with the teams themselves and build an actual project plan in order to do the collaboration together. After that, we go negotiate and build like a business and legal framework. We sign the agreement. If there's a need, like a regulatory need for a trial, which is usually happening when you don't have a CE mark or an FDA. So then we go and submit an IRB together and start working. I can say that all of that is relatively fast at Assuta. Just for example, from the beginning of the process to the approval of the IRB, it takes about 2 to 3 months, which is nothing in comparing to other locations in Israel and abroad. And the negotiations are fairly easy because we've done a lot of those type of agreements in advance, like already on the past. So we have some sort of a template. So this takes a few weeks. So that's basically it. And always also from the business point of view, we try and to see how we are not struggling and putting too many constraints on the company. So it will it shouldn't. Sorry for my English today. It shouldn't interrupt your future. So we are not trying to be a burden on your back. In front of your investors and in front of your future collaborators. We're trying to do our best in order to build a framework that still works, but is not a constraint that you put on yourself for the future. I hope this answers the question.
Pekka is nodding and with the thumbs up, okay. So I think that it did. Excellent. Thank you so much, Daniel.
Thank you.
And Pekka and Tamara for the questions. We're going to move forward now. Next on the stage, we will have Lee Aviram from ARC Innovation, which operates at the Sheba Medical Center. So with that, Lee, I'm going to hand over the stage to you.
Thank you so much. You allow me 1 minute here. There you go. Hold on. For some reason, you know how it is. Okay. Try this. Entire screen. Let's see if I manage or not. Okay. Can you tell me if you're seeing my presentation?
Yes, we can see it.
Okay.
If you want to put it on the presentation mode.
For some reason, every time I do that, something goes wrong. So you'll bear with me.
Okay.
And
Okay.
yeah,
we
so
will.
I've learned from the past. So good morning, everyone. It's wonderful to be here with you this morning. It was great listening to how other partners in our ecosystem work. And at the end of the day, I think the mutual goal for everyone is to really advance healthcare here and across the world and really impact people's lives. So I work at ARC. I'm Lee. I'm director of startups at ARC. ARC is Sheba's innovation arm. I'll give you a little bit about Sheba. I imagine you've heard of it. It's a top 10 or in the top hospitals in the world according to Newsweek. We have 1.6 million clinical visits per year. For some reason, the number of births per year is always astounding to guests and people who work with us. 1,900 beds all in all, 10,000 healthcare professionals. And what makes Sheba unique in another way is that we have been paperless since 2002, meaning that there's been created a data lake from the accumulated different systems working within Sheba. And you can just imagine that incredible database that is now with the digital revolution being so important and critical for us to really advance healthcare. And Sheba's always dealt with innovation. We have a few exits under our belt. Within those 10,000 employees, there are researchers, top of the world clinicians, teams working together, and being part of Startup Nation, as you can imagine, has its element as well. And there have always been innovators, and Sheba is very preoccupied in creating that innovation culture within it. Having said that, for a very long time, it was sporadic. It was a game of chance. Someone who decided to follow through with their endeavor and become an entrepreneur. But what ARC is and what it was born to be was actually ARC was born to streamline innovation. So since 2019, ARC was established as Sheba's innovation arm, encompassing all the activity of internal and external innovation. And of course, these two are intertwined, and doing it in a very structured way. And I'll delve into that a little bit now. So what are the 4 elements that guide us when we are talking about the ARC concept? So first of all, a focus on digital health. So as I said, Sheba was always very innovative, but it did focus on medical device and biotech innovations. So the shift or the putting the light on digital health was important for Professor Zimlich and Professor Kreis when they established ARC. And as I just mentioned, open and organic innovation has always been both elements. I mean, startups have always worked with Sheba, and Sheba has always grown startups within it. But the connection between the two, really streamlining and structuring these processes, is part of the ARC method. International collaboration. So ARC was established at Sheba and by 2 professors, but from day one, ARC has been a global network, meaning ARC has a global communities of different stakeholders who are all share the same vision that ARC has, and that is to create a better, more technological, more advanced healthcare system for all. So the international collaboration is a cornerstone in ARC's activity. And last, but really not least, because we all know that in order to make things happen, you need to know how it's going to work for everyone, is a structured platform, meaning we have structured processes that we are creating, we're constantly redefining in order to really make sure that we are not leaving any stone unturned in our seeking of innovation and cultivating it. At ARC, we have, oh, wait, go right to here. Yeah. So at ARC, we have 5 hubs of hyper-focused interest. As you can see, this pretty much encapsulated every element of innovation that you can imagine, from precision medicine through XR, AI. Obviously, that was the first hub established at ARC, medical device and remote care. And each of these hubs work with all the different layers of innovation that I mentioned before, meaning they all work internally, meaning cultivating internal innovation. They all work externally, may it be partners of ARC as care providers, or partners of ARC as corporates, or partners of ARC as startups, which is a community that I lead. And of course, academia, which is always an important part, and the connection between those things. So if you imagine ARC as a virtual and sometimes a very, very, very physical meeting table, we bring to the table the different stakeholders from the world and from Sheba and from the academia. So across all the different elements, to really shorten the time to market, to make sure that if an idea is on the table, that it's being addressed as soon as possible by the different decision makers that will echo if it's relevant or not relevant. Any questions to this point? Nope. Okay, I'm going on. So today, under the ARC startup community, we have close to 80 startups. As you see, they are differentiated by 4 different sources. Organic innovation, meaning these are companies that have evolved from Sheba. They have a Sheba clinician as a partner. They're based on a Sheba patent or such. Medex, which is the technology incubator we're partners with Boston Scientific. These are all medical device companies. TVARC and Shoshany should be joining here. These are we have 3 different VC vehicles that we work with in partnership: TVARC, TV4, and Shoshany. These are the companies that they have invested in. And Open Innovation. These are external companies to Sheba, just as yourselves, who wanted to engage with Sheba at different stages of their life, with Sheba or with ARC, and both, and we enabled that. I think it will be interesting to talk a little bit about that. And I'll just go quickly through the rest of the presentation and dedicate a few minutes to that. So as I said, we also have a community of corporates. You can see here both health-related corporates and technology-related corporates. Obviously, there isn't a company today, and I can't mention, but we have a very few interesting surprises coming up of partners of ARC that are companies that are not native to health and to medicine, and are choosing to partner with us in order to advance healthcare. When we talk about international collaborations, if you look below, I'm sure that some of these names, probably the major ones and also some of the European ones, are familiar to you. And these are all care providers that are part of the ARC network. So when a company is entering ARC, it's not only working with Sheba, has the potential, has the bridge to work with the entire ARC network. I'll stop sharing here and talk a little bit, with your permission, about how we work with startups, because I think that's really what you all want to hear. So at the startup unit, we have the process, the company journey we have for startups is divided into 2 main elements: evaluation and onboarding, and onboarding, and then community. So we meet an average of 25 companies a month. We have a person who leads that stage. And any company that wants to talk with Sheba, we are happy to have an introductory call with them. Because as we said, we really want to make sure that no stone is left unturned. And because Sheba and the entire ARC network really represent the numerous challenges that healthcare is facing, we are sure that either within Sheba or beyond it, we'll be able to, if it's a relevant solution, we'll be able to find some grounds for partnership. But we do start with home. So any company reaching out to us who is young enough and looking for a clinical study, for consultation, for any kind of that golden Sheba know-how, we bring on a clinician as soon as possible to the conversation, because we're a business development team. We're focused on working with startups. We understand our position as facilitators between startups and corporates and healthcare providers and so on. But at the end of the day, the go no go for us is a clinical one, meaning if a clinician finds the solution exciting, if it finds it relevant to what they're doing, we will find the right partnership model in order to facilitate that. There are some things we're rigid on and some things we're more flexible on. But again, it could be that solution, and we've had instances like this, that there are other solutions such as that particular one. But if the clinician is enthusiastic about it, here I'm creating for you the line between organic and external innovation. Because what we want to create in the end is that enthusiasm towards innovation, towards openness to changing things, to seeing things differently. Once a company is met with a clinician and there's a go, meaning everybody wants to get involved, we evaluate what Sheba will be giving the company in terms of what are we going to shorten the time to market for it, what is the uniqueness of the Sheba know-how they're going to be exposed to. And then we create a dialogue with the company. We're very transparent. We're very clear. We're all about setting expectations. We're not here as the Assuta leader, I think Daniel was his name, mentioned earlier. We're not here to be a bump on your back. We're here to let you advance, and we want to go on the ride with you. So we want to find the way to create a win-win situation for everyone. Once we find that model, and it's really diverse, and we're very flexible, and we're always happy to hear about new models, then they enter the community. And once they enter the community, they are enjoying the entire network, meaning our companies who go to the US and want to meet with a hospital, we try and create for them that opportunity. We have an annual event actually coming up which is for our community, where everybody comes to Israel. Just imagine that. I'll give you a small anecdote that happened last year, not pertaining to startups actually, but to care providers. So we had one of the leading care providers in children's health from the UK and one of the leading care providers in children's health from the US, and they met here at Sheba in Ramat Gan, and they were both very excited about it, and it could only have happened under the umbrella of ARC. So at the end of the day, and that is my big, that is the takeaway I want you to take away. We're always open to hear about startups. We're going to be very clear with you about the process. We don't deal with procurement at all. So we're only focused on R&D and innovation. Some companies who are at later stages are less relevant, or they have to be extremely unique in order for us to engage with them in a different partnership. Really feel free to reach out, and then we'll see if there's a basis to create a more deep dialogue in that. Sami, anything I missed out here?
No, that was great. Maybe one thing to add for the companies, like be prepared, know what you want, and of course this applies not only with the ARC but also with all the other institutions as well. Very good. Thank you so much, Lee. We do have a time for a question or two if we have from the audience, so you can just unmute yourself and go for it. Yeah, Pekka, please.
Thanks, Lee. That was very helpful. You said that you're flexible when it comes to terms, but I guess there is some usual way. So when a startup company comes to you and you can help them shorten their time to market, what's in it for you?
So the ideal model will be some sort of equity, a very modest one. And we usually, it's explainable because we want everyone engaged for the entire ride. And we've found that if we, the equity doesn't mean that the company won't need to pay for the clinical study, for example. That's regulatory element. But it will mean that we'll have as neck in the game. And usually when you have neck in the game, you invest more, you're more involved. And I'll give you one more over on that. We make sure that the clinician involved gets some of that as well. Meaning we want to create incentives for everyone involved in order for this to succeed. This is going back to the win-win way of looking at things. And when I said flexible, it's the fact that it's a negotiation, but it's a smiley one. I don't mean to be, I'm not trying to belittle it, but just saying the main purpose is to advance healthcare. And if everybody wants this to happen, we'll find the model. And I'm sure that the startup would want Sheba to be just as engaged as they want to be. So they would be willing to give up a very modest equity in order for us to be engaged with it. I hope I answered your question.
Good. Thank you, Lee. Thank you, Pekka. Excellent. Again, whoever participates in the delegation will meet Lee and their team then in September. But now we're going to move forward and we're going to hand the stage over then to Clalit Innovation. We have Yael and her team here to be on the stage today. So with that, Yael, please.
Thank you. Thank you very much. Happy to be here. I'm here with my colleague Ifat. We're both business development managers at Clalit Innovation, which is the innovation arm of Clalit Health Services. Hold on while I quickly share my screen. Can you see everything?
Yes.
All right?
Yeah, we can see.
Great.
Yep.
All right. So Clalit Innovation, as I said, is the arm that connects Clalit Health Services to the innovation world. And Clalit Health Services is the largest healthcare provider in Israel. We are an integrated payer provider system. Basically, we are the second largest system of this kind in the whole world. We are the largest one in Israel. In Israel, there are 4 HMOs that cover the population. We are the largest one, covering about roughly half of the population. And we're also the longest running since 1914. Sorry, so 1911. And we and other HMOs in Israel are very unique in the world in the sense that we are very much in alignment on the interest towards keeping our patients healthy and towards prevention. And this is because the way we are funded, we're all funded per capita. So basically we can choose who to cover. And that's why our best interest is to keep all of the people under our care as healthy as possible. And it's great for us and it's great for them as well. And under this notion, we operate. So we have roughly 5 million members in over 1,500 clinics throughout the country and in 14 hospitals that are general hospitals as well as specializing hospitals. And as I said, the largest one in Israel. Another very unique thing about Clalit is the data. And I think this could be like the emphasis today and also the emphasis for collaborations. Like other organizations in Israel, we have electronic medical record for over 25 years. And given the large order of magnitude of the covered people, patients, and the large variety of the services that Clalit provides, this creates a very deep and unique data set that involves or includes all the services and all the records that a patient could possibly have during their interaction with any health-related system. That means going to the doctor or the pediatrician or just for your routine checkup, to the lab to the medication that you are prescribed or purchased, because we also run a network of pharmacies that are our own, to the procedures that you go through, hospitalization, through special registries that we run. So this is a unique data set globally. So, and this one is very much is what we put the emphasis around. The uniqueness, it revolves about, as I said, the care continuum that it encompasses, the fact that we are both the payer and the provider. So it really reflects the natural or the truth coverage of tests and exams and everything that a patient is really going through in the system and really needs to go through. So in terms of real world evidence, it's the real as it gets. And of course, we have multiple types of data sources, but we only have two types of EMRs, one for the community system of clinics and one for the hospitals. And they're all brought together into a data lake that is available for research and is made available to startups in an anonymized form and secure, of course. We are constantly improving the infrastructure and adding more and more data sources. More and more systems are being funneled and brought to this data lake. So this data is always constantly updating and improving. Within Clalit Innovation, we have a few activities. I will briefly mention Clalit Research Institute, which is a globally recognized research center. It is doing real-world data research and was given much focus, or got much focus during, especially during COVID. I will not go further into that because the research institution is mostly working with larger companies, larger pharma, works on national projects, works with the Harvard Medical School and the WHO on very large projects. I will just mention that got much traction during COVID and is using this treasure of data that we have to reach out to each and every patient and help them get the best care possible. And this is, you can say that this is our goal, and this is also what guides us when we choose partners to work with. Another, shall we say, I lost the word, but like something that guides us, another notion that guides us is democratizing innovation. As I mentioned, we're a very large organization. We're actually the largest employer in Israel. And we believe that the, innovation cannot just be in like one office or one center or one hospital. It has to involve everybody in the organization. And that's why we have, within Clalit Innovation, we have actually a structured and effective and systematic way to innovate within the organization through entrepreneurship programs and innovation centers that were set up in most of our centers, hospitals, and clinics in the community. So our innovation centers. So just to make it a little bit clearer, what is an innovation center? It's basically people that work within this hospital or community district, and their goal is to facilitate working, doing innovation for that place. So that's, they're local, they know what's the best things about this hospital, what's the different specialties of each ward or each researcher or each, what are the strengths, what are the needs, and that allows us in the headquarters to collaborate with all of them through this network. So we have here 6 hospitals that are general hospitals with different types of wards and specialties, etc., like any other ones. Some are the largest ones, and some are smaller ones and more focused on maybe certain areas. We have 3 specializing hospitals, one Yael Hospital for mental health, Schneider's Children's Hospital, the largest one in Israel, and Bet Rivka, which is a geriatric rehabilitation center. Also not mentioned here is the Bet Levinstein. Probably I need to update this this PowerPoint, which is another very central rehabilitation center. We also have the community districts innovation, and that's very unique when it comes to being working around innovation in the community. So that's very interesting. So the way that we collaborate or that we operate through this network is that companies can either reach out directly to them, but another way is to reach out to Yifat and I, and we help them we understand, we meet every single one, and we understand which way is the best way for them to work, what are their needs, and we help them connect with the right people within this network. Okay, and the types of collaborations are similar to what you would expect. So we can have data access for startups. I will touch on that a little bit more in the next slide. We can be a clinical site for validation, for clinical trials. We do many of that, of course. We really promote co-development. For example, if you have a product, but you want to just take it to the next level, develop another feature, make it open up more indications for this product. So we're up for that, and we have special, of course, contracting route for that. And only if you just want consultation, just to talk to clinicians, that's also obviously available way to work. So a little bit about data access for startup partners. So I think that any company that would like to go through that path should probably talk to us more in detail and understand better what are their needs and how we can answer them. But basically, we have 2 routes. One is the simple data access. Company can, after a small feasibility test that we do, when we get a company, they tell us what they need actually, what type of data they need. We check that it's available, and then we make it accessible for them on the cloud. Of course, the data is anonymized and secure and safe, and they can access our cloud and analyze what they need. Another way is, on top of that access, is to get some extra experts support. It can be epidemiologists or data analysts or clinicians that help them do their research. And I think that with that, I will conclude. You're all very welcome to reach out and talk to us, and Yifat and I will help you find the best way to work with us. And I'm happy to take questions.
Thank you, Yael. Do we have any questions from the Finnish audience at this point? Beck, yeah, I knew it. Go for it.
It's me again. Thanks. That was very informative again. Since you are an integrated payer provider, that gives you kind of a special opportunity to also do preventive approaches much more than just service provider do. So how do you see that? I mean, we see a lot of interesting business opportunities, but it's hard to turn them into business cases because there aren't so many payers willing to pay for prevention. So is this something that you are interested in?
Yes, we very much are interested, and we very much do it and not just interested. For example, I didn't mention that we have a lot of internal development as well. So for example, we have a system called CPI that takes this data that we talked about and calculates the risk for each patient. And this system is available for family doctors and GPs, and they can proactively predict patients that are under their care. They're not patients that came to their clinic. That's just patients that are under their care in general, and they can proactively see that these are patients that are at risk, for maybe developing diabetes or maybe having some kind of a heart condition in the future, just according to the data, and they can reach out to these people and proactively intervene before they even have any problems. So under this notion, think of all the interventions that we can include under that. So we're very much interested in things, and we are already actively pursuing this area. Yeah, I mean, and I can, of course, elaborate further in person if you like.
Great. Thank you, Pekka. Thank you, Clalit team. I think with that, we're going to move forward and we're going to hand over the stage to Masha. Good to see you. Boker Tov, welcome. And Masha is coming from the Hadasit. It's a hospital near Jerusalem, and I'm not stealing any more slides from you. So with that, I'm going to hand over the stage to you. We cannot hear you. Do you want to try to unblock? No, we cannot hear you. Do you want to try to log in to the session again?
Or maybe you have earphones, Masha?
Okay, I think she's okay. Still no. Do you have the headphones? Hey, Tamer, good to also see you. Are you nearby, Masha, or?
No, unfortunately not. I'm out of the office. Otherwise, I would give her the earphones or my laptop.
Okay.
I'm here. I hope she can join. Thanks. Good to see you.
Let's see if this works somehow.
Woo-hoo!
Perfect. We can hear
Wow,
you.
I feel like I'm a pilot. Listen, the whole office doesn't have any headphones. All right. So
Okay.
let me just share my screen. Truly, I'm a almost Teams virgin. I'm not quite familiar with a platform. I'm a Zoom pro. So let me just make sure I know what I click to share my screen. Yeah.
It's on the top bar on the right corner. It's the box with the arrow up.
Truly apologize for that, but it indeed doesn't have that bar.
Okay. Do you
Maybe
want
that's
me to
what
share
I'm
your
gonna get.
presentation? If I share your presentation and then
Wait a sec. Maybe I have to be on my notice more. You don't see it now, right? You don't see it.
No, no. I have it here. I can share it.
Actually, I've changed it a bit.
Oh
Since I
dear.
sent it to you, but that's okay. If I don't find it in the 5 seconds, then I'll do that.
Okay.
Okay. Oh, old open share tray. Now I know.
Okay.
Do you see it now?
Yes. Yeah.
Great.
You want to put it to the presentation
Of
mode
course,
then?
I will.
Yeah. Okay.
Now,
right.
guys, listen.
Excellent.
I stole 3 minutes from you, but I'll be really concise. At least I'll try. Now, my name is Masha Zavin. I'm marketing director of Hadasit, the technology transfer company and innovation engine of Hadassah hospitals. Now, this is Hadassah, and I'm sitting right here, and I'm talking from here, from the Jerusalem city with you guys. And Hadassah is a very old hospital. It's been here for more than 110 years old. We're a hospital that the girl power is standing behind it. It's been established by the Hadassah Women's Zionist Organization, and we've been here around for quite a long time. But what happens behind the walls is what it actually interests you. So I'll use an example. Probably you haven't still heard about a company called Pathkeeper, but believe me, you will hear about them, and this is really disruptive solution. Company Pathkeeper has developed 3D navigation system for the spine procedures that is going to replace the usage of X-ray in the operating rooms, providing for a very accurate positioning and eliminating the need of stopping the procedure and entering the C-arm into the room. Now, this picture was made by me in the OR, and basically the arrows are showcasing the equipment that has been validated and tested as part of collaboration with Hadasit. Now, very nice, but for every success story, there is a path. And just in a nutshell, to show you, you guys are basically, all of you are somewhere in the road, probably somewhere after the ideation. Some of you are later stages. And this guy, Erez Lampert, was once a specialist that he's good in 3D cameras in the dental field, and he wanted to make sense of it on a higher level and started to looking for taking it somewhere else. And what this kind of people do, they try to talk to surgeons. So he's going through several conferences, and someone told him, listen, talk to Josh Roller from Hadassah. He's a spine deformities guy, and he's really into innovation. And when he talked to Josh, Josh said, listen, Erez, your ideas are not so good. But if you will make the 3D cameras that I can use in my ORs and stop using the nasty X-ray, this will be the revolution. And he was open enough to let Erez join his operating rooms, make pictures with an old iPhone to improve his prototype and work on the algorithms. And eventually, we at Hadasit signed a collaboration agreement with the company Pathkeeper. And after that, they joined the whole ecosystem of Hadassah up until the FDA approval just a couple of months ago, all in less than 5 years. Great story, right? But what is really important about Hadassah and why Hadassah is basically the source of this innovative mind that our physicians are really keen to jump and dive into that. Because I didn't want to bring your numbers about how many beds we have and how many surgeons and physicians we have. The most important number about Hadassah is that being big hospital, we have 1,400 beds, and you've heard numbers before. We are in charge of more than 50% of research grants that go to our researchers. And the thing is that our vision of the Hadassah women is still alive. And for Hadassah, the research and innovation has been one of the most important driving force of healthcare. Now, 10 products are in the market, and someone has to make sense of all this knowledge created in the hospital. And for that reason, Hadasit, the company I'm working with, was established almost 40 years ago. We're a tech transfer company. I'm not going to dive into the concept of tech transfer. Hopefully, we're going to meet here in Jerusalem over a cup of coffee, and we'll talk a little bit about that. And I'll ask you if you know that cherry tomatoes came out from the academia. But what is important is that we are truly understanding that as much as it's important to drive interest on our own IP, it's important to be part of global innovation with the IP that is created outside, created by startups like you. And for that matter, we're coming to the very important question. What's in it for you guys? What's in it for you guys to join the Hadassah ecosystem, to get in touch with us? Now, I have chosen to bring three things today because we don't have a lot of time. And one of them, of course, is the patient data and the R&D facilities. And another one is the Hadassah, the sandbox for you. And the third one is really nice, and I've left it at the end. We'll talk in a second about everything. Now, again, I really don't want to get into details. That's why it's very lean. But it's obvious that a hospital like Hadassah that has such a huge history and is a very big hospital, we have a lot of patient data and medical samples, unique R&D facilities, like, for example, companies come here to do animal testing and the pig models because we have our own surgical theater. And of course, clinical expertise of the doctors that I said are very much into innovation. Now, data that you will probably not going to remember, but again, this presentation is going to stay for you. And I just want to say that we have been collecting digital data for more than 40 years. And what is unique about Jerusalem is the representative population. Since we are dealing with Muslims and Jews and Christians living in the same area, in terms of the developing the algorithms and the point of this kind of diverse population in one single setting provides a very tangible added value. So remember that Jerusalem is good, and we stand on that. Now, the last thing that is really running around is that very soon we're gonna be able to provide one single dashboard with the help of the company called Bria, the access to the data sets, not only of the two hospitals in Jerusalem, but also of the major HMO in the area. What it means for you is that you will be able to track, if you get to the access to the data of these patients, from the community clinics back to the hospital and back to the community clinics. This is something that has never happened before in the area, and we're very, very looking forward to the systems to starting being available to the companies. When we're talking about types of relations with startups, again, you're all familiar with your needs. Some companies want consulting services, need researchers to be on their scientific advisory boards. Some want to go for pilots. We're not going to get into each single type of this. It's very redundant, I believe, and I don't want to waste your time. What eventually you want to know is that how we do that. And what is the word of flexible models say when companies like ours and the hospitals are telling that? Well, the most easiest way that is very obvious is that it's possible to collaborate and to engage with the ecosystem of a hospital on the basis of service for fee. You can pay the doctor, he becomes your clinical advisor. If you want to do a clinical trial, you can pay for the clinical trial. The most interesting part for startups usually is the way how you transform this into collaboration. And I want to be very honest with you. If you want to transform it into collaboration, there are two main reasons for that. The first, the moment the hospital is part of the process, the engagement level is very, very unique because the hospital is partially feeling that is responsible of the success. Sometimes for the companies, it's a very good way to utilize the lack of funds at certain stages. I'll give you an example. Forget a budget for data sharing agreement of $50,000, and the company says, listen, guys, we have only $20,000. There are other models of consideration that can be used, either options or royalties, etc. This is something that is very important for me to share with the companies that join us, that we are not limiting any possible way of how we're gonna frame the collaboration. The company is usually there to decide what they choose. If they want to go for service for fee or to go for some other types of considerations. And the third thing is the co-development. It happens a lot in the area when the mixture, the combination of the forces of the researchers in the hospital and the startups that bring their tech innovation, create new IP. And we have such examples, and I will be ready to share more when we meet physically here in Jerusalem. Now, last but not the least, and I will give a disclaimer that we do have our own digital health accelerator powered with IBM Alpha Zone. Currently, we are working mainly with Israeli companies, but just within 2-3 months, we're making a decision to open it to the global stage and to work with companies from abroad. And the Hadassah Accelerator is basically an accelerator for digital health startups and MedTech, usually early stage seed and post-seed. And this is a 6-month program that is done with a partnership with IBM Alpha Zone. The main idea behind that is that Hadassah brings medical excellence. We're here to bring a champion from the clinical staff that is going to follow and accompany the startup during these 6 months. Whether it's going to be the ethics and the RB committee tackles and building protocols for the clinical study, et cetera, and IBM bring their global exposure and deep tech consulting, and of course, IBM cloud credits. And I'm leaving aside all the classical things that are connected with external experts like IP, et cetera. But in the fact, what interests companies and what interests Hadassah is that for us, this is an opportunity to see from the very beginning and to maybe adopt the technologies at early stages here at Hadassah, of course, promote commercial collaborations with companies, that in the end of the day, we must say it, and I don't think that it's cheesy, but we do want to impact the healthcare at large because, as I've told you in the beginning, Hadassah women and their vision was to transform the healthcare in the area of Palestine at the time, in the beginning of the 20th century. And up until today, we truly try to follow their steps. Now, the last thing I want you to remember is that Hadassah ecosystem could be a sandbox for beating medical innovation. And I'm happy to hear your questions, and I hope I was in time.
Thank you, Masha. I think we have time. One quick question from the audience. Let's see if Pekka is fastest again this time. No, all clear. Good. Thank you so much, Masha. It's always good to see you. Thank you also for our other speakers from the other hospitals and health institutions. It's always great to have you on the stage, and thanks for letting us pick your brains and sharing what you do, how you do it, and why you are doing it. Next one, I'm gonna take over the stage now and basically go then through the actual the delegation agenda. But before that, very briefly, I have 20 minutes time, so I briefly kind of like open up a little bit more about the Israeli health tech sectors. We've been hearing today 4 leading health institutions in Israel, but that's not all. There's a heavy involvement also from the government. For example, IIA, Israeli Innovation Authority, is one of our key partners. There is a MOU signed between the Business Finland and IIA to support innovation collaboration in life science. There is a very strong academia. Multinational companies are an important part of the Israeli health tech ecosystem as well. We have heard today from various healthcare organizations, how do they operate and what are they looking for. Of course, money is important piece of the puzzle, and in Israel there is about 250 health tech focused investors. And very quickly, if you look at the last year's numbers, the health tech sector in Israel fundraised about 2 billion USD in 166 rounds, which is quite a remarkable. About half of that went to the digital health, followed by then the medical devices and then a pharma. So those are kind of like the key 3 areas. And of course, then the various hubs, including the accelerators and incubators and what are also strongly present here in Israel. Then also, what is the secret source, if there are any one silver bullet? But in Israel's case, basically, you have heard about the HMOs. So there's 4 of them in Israel. We have heard today from Clalit and basically Maccabi, under which Assuta hospital is, and those 2 cover 75% of the Israeli population. The national health care is universal, it's free. All the people in Israel are covered. There's plenty of data here, also like in Finland, and like Masha mentioned, the diversity of the population makes it also really interesting. And then if I compare this to Finland, where there's very homogeneous population, and in Israel it's the opposite. So that also it's a very interesting angle for the R&D and various kind of collaboration. The supporting technologies and technology strengths, obviously when you have a lot of data, the AI and machine learning are kind of like the natural part and continuation of that. Everybody knows probably that Israel is a super strong in cybersecurity. Again, it's a very important in healthcare, AR, VR as well. And then if we talk about the human capital side, you have heard today also that many clinicians and doctors are also entrepreneurial. This is very Israeli DNA and mindset. Everybody has a side hustle. They try to innovate, come up with the new ideas, come up with the new businesses, and this also applies to the doctors. The role of the defense and the military is important. Everyone goes to the army here, 3 years or 2 years, depends how you male or female. But also then the mindset that the army is teaching the people in terms of the innovation, responsibility, making really rough decisions ad hoc, are basically the ones that are suitable for all the entrepreneurs, right? And also then you can actually take your IP with you from the defense. And we see that there's a lot of spillover effect. So it's not only the cybersecurity and hardware and the defense side, there are a lot of innovation coming to the other verticals, including the health tech as well. Multidisciplinary approach. Israeli entrepreneurs and ecosystem is very technology first. They're very good of building deep technology solutions, and they're very good also pivoting very fast when they see that there is an opportunity in the other vertical. Government is running multiple support programs, especially in healthcare. There's, for example, the National Healthcare Information Exchange, which is a little bit similar as the Kanta service in Finland, which basically connects the healthcare providers and enables the doctors to get the access to the patient's health data at the point of care. National ID operates as a key for the data, like in Finland. And really kind of like the health data interoperability is well built here. Academia we talk about, and the MNCs we talk about. So those are good to understand. Then a few words about our collaboration. So Finland and Israel HealthTech collaboration over the years. So first of all, we do have Team Finland has a resources here available and present, Tel Aviv. It's me and our team here. Healthcare is one of the key focus areas for Finland in Israel. I mentioned earlier that the MOU in life science was signed last year between Business Finland and Israel Innovation Authority, and we've been doing a lot of activities around that, finding testbed, pilot, validation, business opportunities for Finnish companies in Israel, but also then the Israeli companies in Finland. And with that, of course, the regular delegations and trade missions visits are part of the or it's an important tool and part of our activities. And also with the investors. So Slush is a very good platform for us every time to bring Israeli VCs, industry agnostic, but also including the healthcare, and also, for example, from the recent example, the European Health Tech Investment Forum from the May this year, where there was a group of Israeli VCs visiting. Good. Then the agenda for the upcoming trade mission. So this is still a little bit tentative, but I would say 90% is confirmed. So all the meetings with the key leading hospitals and institutions are secured. And we're going to start on Tuesday. I also want to start basically with the overview of the Israel Health Tech ecosystem, and obviously Startup Nation Central. which operates here, which I also borrowed those couple of previous slides, is the best entity to do that. So they will give you a very good deep dive of the overview of what is the latest status of the Israeli health tech ecosystem, what are the latest trends, where it's going for, and so on. Then on Tuesday, we have planned a visit to Arc Innovation. And then after that, idea is to also to understand the Israeli business mindset and the culture. So we're going to have an expert talking about what are the differences between, in this case, Finnish and Israeli business mindset, and what are the things that you really need to understand to make a successfully business with Israelis. On Tuesday evening, we are planning to have an investor Shark Tank session with you. So we're going to gather some local health tech investors to hear your pitches and also then give you feedback. Wednesday comes, we're going to visit Assuta Hospital. So Daniel was giving you a good overview of what they are doing. After that, we will go Clalit Innovation. Then the plan was to have a second learning series session. You have heard US mentioned quite a few times today, and this is also because US and Israel have a very specific relationship. There's a lot of money, VC money, coming from US here, and it's usually the primary one market for the Israeli companies to go and scale up. So they know how to do it, and I think that this is also good to important in when you come into Israel, that this is something what maybe we should learn and hear how they have done it successfully. So let's tap into that knowledge as well. Wednesday evening, we are planning to have the reception at the Finnish residence hosted by our dear ambassador. Obviously, it's a good networking event. We always give the opportunity for the Finnish participants to invite their own guests, or if they have some other stakeholders from here who they want to invite, they can do that. And then on Thursday, we're going to visit also one of the government hospitals here in Tel Aviv. IMED is basically their health tech ecosystem. It's located at the Ichilov Hospital. And then we jump to the bus. We have our own transportation. Naturally, we go to Jerusalem to visit the Masha, Hadasit, Hadassah Medical Center, and then to kind of smoothen the week, we also want to take you to the magical Jerusalem. So we're going to have a guided tour in the old town and enjoy some good falafels to wrap up the week. And on Friday, we before we let you go, we would like to have a feedback session, hear a little bit from you. How was it? What key findings? How we can continue supporting you after this? And then there's a Finnair flight to Helsinki very late in the evening. So Finnair is flying 3 times a week: Monday, Wednesday, Friday. Helsinki, Tel Aviv. Of course, there are plenty of other options during the week through Istanbul, Frankfurt, and whatnot, if that's something that you want to consider. Travel restrictions, currently there's not really much. The only thing that your insurance needs to cover basically the COVID part. Otherwise, we are pretty good with those. There will be a participation fee for the companies to cover the expenses. And here are the prices for the small businesses and then for the bigger companies. And this will not then cover the flights and then the accommodation. But otherwise, we're going to take care of you during the week. So obviously all the receptions, transportations and whatnot, networking lunches are covered with this fee. Next steps. We do have a registration form and a page open, thanks to Business Finland team. The link is here. Maybe, Sene, we can also put that to the chat at the moment. But like I said, you will receive all those presentations, including this one, either today or tomorrow with the recording. So then you will have all the information. We have a deadline for the registrations, 19th of June, so just before the midsummer. Juhannus comes because we also want to do a little bit coaching for you, hear how you pitch, and a little bit coaching before then the September comes. Personally, I will be in Helsinki at the Radical Health Festival in the mid-June. actually with the Israeli delegation, but obviously I will be available if someone wants to set up a meeting, hear more about the delegation, what to expect and whatnot. So happy to meet you in person. Good. I'll stop my monologue now, and hopefully we have a lot of questions from the audience. Please. You can just unmute yourself and ask. Pekka, I'm looking you now.
No further questions. Everything was so clear.
Okay, excellent. Anyone else? All clear? Okay. Good. Job well done at this point. But like I said, all the materials will be. Sorry, was there? Okay, no. Okay, like I said, all the materials recording will be shared with you either today or tomorrow. So then you have it. And like I said, of course, I'm here available for any further information, for the questions. And like I said, I'll be personally in Helsinki, so then we can catch up and continue conversation. And with that, and if we still don't have any questions, I want to thank you, everyone, for joining us today. Thank you for our speakers. Once again, thanks for the Finnish participants, and I hope that this gave you a good overview of the Israeli health tech ecosystem, what the different kind of healthcare providers and institutions are doing, and what kind of opportunities that might open for you. So with that, thank you.
Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.
Thank you. Bye.
Thank
Thanks,
you.
bye.
Bye.
Bye. Thank you.